good girls? Okay, so for those of you joining us on Instagram, and now Facebook is up too. Hi, we wanted to make sure everyone's joining us. Give them a little time to log on as well. I'm Beatriz Canals here at Nicholas Children's Hospital, and we're live today to discuss a topic that's really pretty popular on social media right now. It's being discussed a lot, and that is sleep training techniques or sleep training our babies. For those new parents out there that are having a really tough time getting their kids into a schedule, being able to put them to sleep, hopefully having them stay asleep for as long as possible and getting good rest. We're here to bring you some really good tips, some information, some different methods, and also to break down some of the myths, concerning all of this. So joining us now is Dr. Lauren Chiriboga. She is the pediatrician here with the Pediatric Care Center at Nicholas Children's. Thank you so much for being with us,
Absolutely.
Doctor.
I'm so happy to be here and to be talking about this topic.
Yeah, and so much help for these new parents or
I hope so.
expecting parents who are all nervous. And so you'll have an advantage for those of you expecting moms out there that are going to be joining us now. If you have any questions about this topic, because perhaps we won't exactly address everything that you're wondering about, please be sure to send us those questions. Or if you're fairly new parents or have an incredible experience and you found some sleeping techniques that really worked with your child, please feel free to share them with us, and we'd love to try to get to it before the end of this discussion. So I guess first up, Doctor, explain for those who aren't familiar with what are sleeping techniques or sleeping training techniques.
Yes, so that word sleep training, it's a little bit popular nowadays. I think it's always been popular, but in the recent times it's come up more. So the term sleep training really just refers to the different ways and methods that parents can use to teach their child how to develop independence as it relates to sleep. So that kind of sounds funny, like how is my child going to be independent in sleep? Like, why does that matter? They're too little. So if you're a new parent or just any parent of like an infant or a baby, you know that your child often relies on many external factors to go to sleep. Rocking the baby, feeding the baby again in the middle of the night. Some toddlers even may require a parent just to be in the room to fall asleep. And so this is great until a certain point, right?
Until it's not.
Yes, it's great until it's not, right? Exactly. And so the point of sleep training is to eliminate that dependence on those crutches, because they really do become crutches after a while, right? And to just allow kids to build a sense of confidence, security, safety as it relates to going to sleep, in a nutshell.
That's a great explanation. So give us, if you can, an idea of perhaps some of the most popular methods.
Yes, definitely. So we're going to say it, cry it out. There, I said it,
Cry it out.
Yes.
It's a tough one.
It's a toughie. So it has stood the test of time because it's kind of controversial. It's unpleasant, definitely, but it does work, right? So cry it out is the number one, the most traditional method of sleep training. It's also known as the extinction technique, because the whole point is to extinguish a behavior that we don't want by ignoring the behavior. And so in this case, you're extinguishing crying or wanting to be fed or rocked or any of those things that I mentioned. So as the name suggests, the way Cry It Out works, you get your baby, you make sure that all of baby's basic needs have been met. Clean diaper, baby's fed, PJs are good, like everything is just like the basic needs have been addressed. You put your baby in the crib and you kind of just address the fact that, good night, we're going to sleep, mommy's going to be here the next morning, and you leave the room. And it sounds simple, but it really is not, because then what comes after that is a lot of crying. And so
not always, right? Some babies.
Yeah, not always. Right. It's usually like a, expect the best but plan for the worst. What is it that they say, right? And this may happen for anywhere between 10 minutes to an hour. I kind of, from parents, I hear a lot of different things. I mean, my son cried for like 45 minutes the first night.
Goodness.
It was rough. But this method is the one that will kind of get you there the quickest. There are others. So there's another one called the Ferber method, named after the doctor that popularized the method. And we also call it graduated extinction. So it's like Cry It Out, but a little light, a little gentler.
Cry It Out light?
Yes, Cry It Out, like beta version of Cry It Out. And so what that involves is the same thing I just described, but instead of leaving for the whole night, you'll go back in at set intervals. So 5 minutes pass, of crying, you go back in the room to kind of reassert your presence. Mommy's still here, good night, we're not picking up the baby. Because that's the whole point of this, right?
Okay, so there's no picking up the baby.
No, because that's what we are trying to extinguish. Yes, and break that cycle. And so, you go in at 5 minutes, reassert your presence, leave, do it again in 10 minutes, 15, 20, and so on and so forth. And while that is a gentler method because you are going in to check, it's also a little more laborious because you're going in to check.
Yep.
You
have to be up every 5, 10.
Exactly. Exactly. And there is a lot of literature out there, like in the medical pediatric community that shows that cry it out is kind of like the quick and dirty method. 3 days of cry it out and you're done. Whereas Ferber method may take a longer time, 7 days, 8 days.
And for parents who simply are listening to us right now and they're like, there's no way that I could listen to my child cry. That has to be really hard.
Yeah, it is. It's definitely very hard. And, parents in most households, right, we have usually 2 parents, right? In that case, I think it's really important to not ignore the idea of compromise, right? And so speaking to your partner about, well, what are you comfortable with? Because if I'm comfortable with something and you're not, then we're going to fail, right? That's setting us up for failure. And so it's kind of like a meeting in the middle kind of thing. What can we as a family be consistent with doing?
Which I think is great to be having this discussion, as I mentioned earlier, for expectant moms.
Yes.
Because perhaps they haven't thought of having this conversation with their partner, with their significant other. So it's something you can already start having now before the baby even arrives, so you're on the same page.
Yes.
And you have a plan, and hopefully you'll be able to stick to it and it'll
Absolutely.
work for you.
Right.
Now, also online, we see that some parents who are not willing to follow these methods or fearful of it, it has to do with some myths pertaining to these methods. What are some of those myths?
So yeah, there's as with many things in parenting, right? There are myths that perpetuate, and sometimes for good reasons. So the biggest myth that I hear is, well, if I sleep train my child and let him or her cry it out, it's going to damage the bond that I have with my child. I think that's the feared complication of this.
Sure, that makes sense.
It makes perfect sense. You are putting your child in a crib and you're letting them cry, right? Like that's not fun. But remember what the whole point of this is. The whole point of Cry It Out and sleep training is to create a child that's independent, a child that feels safe, that feels good in their crib, in their room, in their environment, and that can self-soothe. Absolutely. That is the skill that we're working towards, right? So the way I explain to my patients' parents in the clinic, I kind of say, well, I don't know about you guys, but I wake up at night, right? Like, you're laying in bed, you wake up a second, and you're kind of disoriented, roll over, check the time, it's 4 a.m., let me go back to sleep. No drama, right? For a baby, that's not the case. They wake up and they need something to help them go back to sleep. And so that can be kind of a fearful situation or a stressful situation for them. Through sleep training, you are eliminating that problem for them because you're allowing them for just a few days, kind of go through a rough patch, but then from the end of when you're done sleep training through forever, you're giving your child the confidence to do exactly what I just described that we as adults do. And so instead of thinking about it as, oh, I'm letting my child cry, you are creating a child that is more confident, right? And better able to handle that situation, which for us we take so for granted, but is kind of uncomfortable for them. So you're actually kind of strengthening your bond with your child in a way, and you're giving them a skill. Yeah.
Yeah, see, that has to make you feel a little better.
Yeah.
It still will be difficult, I guess, to go through it when you're going through it. But it's good to know that on the other side, you may actually have an even better and a happy and healthier home, right?
Absolutely.
Because for parents, I remember those first few months, even the first year, that is so difficult.
It's so difficult.
You can't get them to sleep or they get up at all hours. You're physically
exhausted,
drained and emotionally drained. It's tough. So
right.
I think if you're able to have these methods and give them a try, what do you find is the most difficult or the greatest struggle that new parents have when it comes to this?
I think it's that combination of the struggles of becoming a parent, so like going from 0 to 1 versus going from 1 to 2, right? Now, I'm a new-ish mom. I have a almost 2-year-old, and so I don't know what that transition of 1 to 2 is, but I know 0 to 1 like really rocked my world. So I think, I think it's that combination of becoming a parent, changing your identity, plus sleep deprivation. Let's not ignore that, right? And you kind of, maybe some moms out there can agree, you feel like you're in this forever, and that this is going to be...
moment, it feels like it's going to be forever.
Yes, and this moment is going to be just my life now, and you can't really see a way out of it. Sleep training is a really good way to make that end, not just for your baby, but for you too. you know?
And then you can enjoy it so much more.
Yes, and then the house sleeps. It's not just your baby. Then you're sleeping and like the dog is sleeping and your husband's sleeping and,
Absolutely.
you know? Yeah, so, and I think also when there's a sense of frustration, like let's have a hypothetical where, you know, a mom with a 6-year-old who still needs to be rocked or bottle fed. I see it all the time. 6 years, not 6 months, 6 years, okay? That's a frustrated household. And yeah, you're rocking your child to sleep every night, you're not letting him or her cry, but you're frustrated as a mom, and so is dad or your partner. And a 6-year-old can feel that. Can totally feel that energy and those vibes and the negativity that may surround bedtime. So it's kind of like a pick your poison kind of thing, but I think that sleep training is a much better way to address that.
So, doctor, you have seen that as old as 6 years old sometimes, how difficult that it does have to be for the household.
Yes, definitely, and not just for the child, for the parents.
And
siblings.
And
siblings.
It throws everything off, right?
Absolutely, absolutely. So this is the best way, I think, that we can try and cut that out.
Cut that out. Yeah. Anything you'd like to add, and we'd like to take, do we have any questions as of yet? Okay, so, well, first, I do have one question, if you don't mind me getting one in. My daughter, Victoria, became a mom just 13 months
Congratulations.
ago. Thank you so much. Our granddaughter, Charlie, and she's had her struggles. The first few months, it seemed to go great. Then they had to travel out of the country, came back in, and that threw her off, the travel. Then it was the teething that threw her off again. So one of, I guess the first question would be, should you be ready to accept that? So let's say that there are new parents there that are trying one of these methods, it works out for them great, and then suddenly something throws them off. What do they do?
So first off, this is totally normal, right? And in no world are we expecting to sleep train a child and from that day forward they're going to sleep perfectly. That is not the case. So I think the first thing to address is managing expectations, right? So we have to go into this understanding that it's going to get better. It's not going to get solved right away, okay? You have some wins and you have some losses.
No quick fixes.
There are no quick fixes, right? And that's going to apply to many things in parenting, not just this. When you do have a setback, it is kind of like a reset button.
Okay.
But I find that you're not starting from 0 every time. You're starting from 0+, and you kind of make that improvement. So the progress kind of, you know, you have some dips, but overall we're going in this direction.
That's great.
Right. And it's worth mentioning also that just when a kid starts learning a new skill that's really cool, like a 9-month-old is starting to stand in their crib, they want to do that at night, okay? And that brain is really, really active at night. And so this is going to cause a regression. It's going to cause a bump in the road. But I think parents should not be discouraged by this. They just kind of consistency. Consistency is key.
Yes, I don't think the method isn't working anymore. It's
Correct.
just it may take a little longer if it interrupted somehow.
Absolutely.
And then
absolutely.
The other question that Victoria had is, are there repercussions to cry it out in terms of brain development and amount of time crying? How long you let your child cry?
That is such a huge concern, and I get that question. I did all this, by the way. I did all of this that I'm saying. I promise I'm not a hypocrite. Like I did it all. I practice what I preach. And yeah, I had concerns too. Even as a pediatrician, you know, I looked up the literature and what does it say? So the answer to that is no. There are no repercussions pertaining to brain development, pertaining to inflicting trauma on your child, as long as they are old enough to handle sleep training.
So good question. How old is old enough?
So 4 months is our earliest that we can start. There's some literature out there that suggests 3 months, but the most robust and circulated studies say 4 months. And so I say 4 months. That's what I tell my patients and their parents. Once we're at 4 months, you have free reign to do it. Doesn't mean you have to start at 4 months, but that's the minimum.
And is it fair to say that's pretty for any child?
Or
does it depend?
It depends. So for any child that doesn't have a really a chronic underlying medical condition, for example, a child who was born really premature, 23 weeks. We do see those babies who survived, despite being born so early. In that case, we may take a gentler approach because we use something called corrected age, where they may be 4 months old, their body may be 4 months old, but their brain is maybe 2 months old.
Okay, so take that into account.
Yes.
And as always, check with your pediatrician.
Always
right?
check with your pediatrician. Always,
front
always.
lines, always.
Yes, yes.
So any takeaway that you have for the parents that are joining us that you hope that they'll remember from this
Yes,
topic?
definitely. I think the biggest takeaway that I would want anyone to glean is that sleep training can be a positive experience. There's a lot of negativity. It's like a black cloud in our parenting journey, right? But just remember what it is that you're doing and what you are doing it for. What is the goal? And what skills and gifts really are you giving your child for the future? You're giving your child the ability to be confident, to feel safe and feel happy in their room in the middle of the night, right? And so if you just spin it that way, you will see it can be a very positive experience. And also, I did want to say that it's not for everybody. So if you're somebody who's hesitant to sleep training, or you're just like, no way, you are not wrong. This is not for everyone. You know, every family is different, and if it works for you, then it's the right answer.
Absolutely.
Yeah.
That's been tested.
Yeah.
We do have one more question. Gabby, go ahead.
So somebody asked, when should Cry It Out begin age-wise? So would that also be 4 months?
Is that 4
Yes,
months?
yes, 4 months. Cry it out is totally fine to do at 4 months. Again, assuming that your child has no underlying chronic medical conditions.
I know that there are so many parents, because I know, that must be listening to us now and thinking, oh my goodness, but can I let them cry? I think it's wonderful that you're letting us know that, number one, it's okay. You're not abandoning your child.
No.
It's good to give it a try, and that if it works on the other side, the benefits sound like they're just wonderful.
Absolutely, definitely. And I can say, just forget the white coat. I'm a mom too, and I did this, and now I was going through it. My husband and I were just going through it, but now I have a little boy who sleeps really well through the night, and he's happy to go to sleep.
Oh, I love that.
So that's
Absolutely.
really rewarding.
Well, thank you for sharing your
Of
personal
course.
story and your expertise. We thank you so much.
Thank
Doctor, for being
you.
with us.
Thank you for having me.
And for all of you joining us from home, we hope that this helped you figure it out. And the best thing, I think, is that the doctor mentioned there's no right or wrong.
Mm-hmm.
We wish you the best, that your children will have a good night's sleep, and so will the entire household. Be sure to follow us. Continue to follow us on all of our social media channels here at Nicholas Children's Hospital. I'm Beatriz Canals. We hope you have a great night. Sleep well.